Вот тут вот писать им, да, если что?
Сверху тут мягкие нажмете,
Угу.
чтобы она большая.
Do you hear me? If yes, bring something in chat. Colleagues, everybody hear me? Is everything okay with sound? Okay, 2 minutes and then we start.
Что не говорите ничего? Я
Ну, там 2
проверяю.
минуты.
Проверяю. А что ты молчали? Может, динамик?
Не-не, я проверил, я не спросил, есть звук, или нет. Сказали, что есть. Okay, colleague, let's start. Today we are going to speak about quite wide topic and very widespread pathology of nose and nasal cavity is rhinitis. Yeah, different types of rhinitis. But firstly, I want to remind you about anatomy of nose and nasal cavity. Yeah? As you remember, nasal cavity is the initial part of respiratory tract, and as any cavity, it has some walls. Yeah? Medial wall, it is nasal septum. Inferior wall, it's tegmen that separate the nasal cavity from brain floor or fundus. Yeah? Lateral wall, anterior it's nostrils, yeah, and posterior it's glands. If you examine nasal cavity here, you can see on lateral wall three nasal turbinates, yeah, three nasal conchas. Superior turbinate, inferior and middle and inferior, and these conchas form three nasal passages or meatus. Yeah. Superior, it's between superior concha and middle concha, middle between middle concha and inferior concha, and inferior it's between inferior concha and floor of nasal cavity. Yeah, from the anatomical point of view, the lateral wall is the most difficult in building. And from functional side, it's the most also most important wall, because on this wall all paranasal sinuses are drains. You remember that nasal cavity has two areas. It's the respiratory area and olfactory area. Respiratory area is for breathing, olfactory is for smelling, yeah, and its localization is on the medial surface of the middle nasal concha and superior nasal meatus area. And you remember that it is innervate with the first the brain nerve, nervus olfactoris is innervate this zone. So one of the most important structure of the nasal cavity is osteometal complex. Yeah, osteometal complex is a part of the ethmoidal bone and represents a system of passages and holes in the area of anterior parts of the middle nasal meatus. Why it is important? Because all sinuses of anterior groove are opened in osteometal complex, and any problems in structure of this complex may lead to problems with paranasal sinuses. Okay. So what structures form osteometal complex here? It's middle turbinate, it's uncinate process, bulla ethmoidalis, or ethmoid bulla infundibulum, hiatus semilunaris, and inferior turbinate. Yeah. On this picture, you can see a CT scan of paranasal sinuses in frontal view, yeah, and you can see the structures of osteometal complex, yeah, and for example here is the picture of patient after operation, yeah, because here processus unzenatus is deleted, yeah, is removed during operation, and you see a big opening of maxilla sinus in nasal cavity. Yeah? So what structure here we can see here? Yeah, middle turbinate, bullet myodalis. Yeah, it's here you can see processus uncenatus, and here you can see that the mucus of nose and of nasal cavity, yes, is transformed, and probably it is polyp tissue. Also, we can see, and scientists divide such structure as nasal valve. Yeah, nasal valve is a specific triangular slit-like formation between the lateral cartilage in place of its attachment to septum nasal and septum itself. Yeah, here. So it's nasal valve. Nasal valve play a quite important role in direction of air flow in nasal cavity. Also, as you remember from the histology, from the pathogistology, yeah, respiratory area of nasal cavity is covered, is laid with multi-row cylindric ciliary epithelium that consists of three main types of cells, yeah? Or another name, pseudostratified epithelium. Yeah, pseudostratified because pseudostratified, it means that there is one level of cells, so all cells are localized on basal membrane, but the nucleus of cells are localized on different levels. It means that such type of epithelium is pseudostratified. So three main types of cells: ciliary cell, yeah, with the cilias on the top of the cell, goblet cell that produce mucus, and basal cell that may transform to goblet or ciliary cells. The main thing that allow nose and nasal cavity to work properly, yeah, and to provides all functions of nasal cavity is mucociliary transport system. Yeah. What is mucociliary transport system? Yeah, if you understand the name of this system, you may understand what does it mean. So mucociliary, it's mucus that is produced with goblet cells, and ciliary, it's series of ciliary cells. So it means that mucus that is produced in nasal cavity cover the pseudostratified epithelium, and this mucus is transported from the nasal cavity by beating of cilia. Yeah, it's so-called mucociliary transport system. Mucociliary clearance is the first protection line. It prevents fixation of an alive or dead antigenic material on the surface of mucous membrane and its penetration inside. So it's something like shield from pathological agents. Also, another part of in structure of epithelium is basal membrane. Yeah, divides on the mucous membrane of divides the mucous membrane of nasal cavity into two layers. So epithelium, yes, and under this basal membrane is lamina propria with connective tissue and blood cells. The second layer of protection provides local immunity. Yeah, mucus contains non-specific and specific factors of protection. It carries out the proper function. Yeah, so it's recognition of antigen, inactivation of antigen destruction, neutralization, and removing the foreign antigenic material with the help of mucociliary transport system. Yeah. You remember that nasal cavity has some functions as respiratory function, protective function, reflex, conditioning, information, secretory, aspirating, and olfactory. No, respiratory, it's very obvious. What does it mean? Protective. It's returning to back to this slide. Yeah, it's provides local immunity. Yes, with not specific and specific factors of protection. Reflex, it's sneezing, because sneezing is also protective mechanism for removing big parts of, for example, dust. Yeah? Conditioning. Conditioning is also very important function because only if you breathe with nose, yeah, the air can be adapted to temperature of your body. Yeah, so if the weather, if temperature of environment is hot, the air become more cooler. If the environment temperature is cold, yeah, its opposite, air become warmer. Information as the nasal cavity is a part, is some elements of nasal or in nasal mucosa is a part of immune system. So through the nasal cavity mucosa, our organism also contact with different sorts of antigens, and we receive information about these antigens through the mucus of nasal cavity. Secretory is the producer of mucus. Aspirating, it means that mucus that is produced in nasal cavity with mucociliary transport is moved to nasopharynx and then normally is aspirated. And olfactory, its olfaction, it is clear. So yeah, as you can see, while passing the nasal cavity, the air is clear, warmed, humidified, and neutralized from different antigens. So what is inhalation? It is an air stream along the middle nasal concha, turbulent movement. Yeah, And if all mechanism of protection is worked properly, 60% of pathogenic microflora settle down in the nasal cavity and neutralized in nasal cavity. Exhalation. It is an airstream along the inferior nasal concha through the crown. So reflex function. So one reflex we mentioned, yeah, it's sneezing. But there are other reflexes. So three groups of reflexes are divided. It's intranasal due to different deviations of nasal septum. Arise in the nasal cavity and influence the function of the other organs, for example, as in the case of bronchial asthma. And sometimes the irritation of other organs can cause changes in nasal cavity. So what is condition function? Yeah, it's uh, adopting of temperature of air and air humidifier. Yeah, you know that approximately 500 milliliters or half a liter, yeah, of liquid is produced in nasal cavity every day, and because of proper functioning of mucociliary transport system, you don't feel this, yeah, because all this liquid is transported in nasopharynx and then is swallowing in stomach. And you remember from physiology that thermoreceptors of cold and heat influence the cavernous venous plexus that are localized in inferior nasal conchas. Yeah? And when you breathe in, for example, the cold air, this plexus is enlarged. Yeah, the flow of blood in these vessels increased, and it lead to reducing the volume of nasal cavity due to swelling of nasal mucosa, and it lead to warming of air that pass in. Yeah, and in a case of hot temperature of environment, it will be the opposite situation. Information function. Yeah, nasal cavity mucosa is constantly contact with antigenic material. Epithelial cells are antigen presenting, and the nasal cavity informs an organism on antigenic structure of the environment. Now, it's here you can see one of the method of researching of mucociliary transport system. It's the piece of a paper, special paper that is impregnated with some ink, yeah, or substance with the blue color. Yeah, this piece is localized on the anterior end of middle concha, and then we measure the time from the placing of this piece of paper on the anterior end of middle concha until it's appeared in nasopharynx. Because due to mucociliary transport system, this ink, this spot of ink, move from nasal cavity to nasopharynx. Oh, these methods, it's so-called anterior rhinoscopy, uh, when we use nasal speculum, yeah, and we can see during this investigation main structures of nasal cavity, nasal septum, middle concha, inferior concha, and the mucosa. Uh, it is so-called posterior rhinoscopy, yeah. With this method, we can examine nasopharynx, yeah. So we direct the source of light to the mirror. The mirror, this light reflects from the mirror surface, and then we can see in this mirror the structures of nasopharynx. Yeah, also coans, nasal septum, turbinates, and the top of uh, nasopharynx. But of course, it is better to use modern methods of investigation, such as endoscopy, because only endoscopy allows you to provide a correct uh, full investigation of all structures of nasal cavity, especially of such structures that can be observed during routine anterior rhinoscopy. So now let's speak about uh, current topic. It's acute and chronic rhinitis. So acute rhinitis, it's acute inflammation of nasal mucosa, and chronic rhinitis is chronic non-specific dystrophic processes of the mucous membrane of the nasal cavity, which develops as a result of the prolonged or often repeating acute inflammation of them under action of some exogenous and endogenous factors, and also in constitution anomalies. In structure of ENT disease takes the second place, and almost 50% of population are ill. But I think that if we are speaking about acute rhinitis, so uh, each person have several episodes of acute rhinitis during their life. So, what the pathogenous factors of rhinitis uh, exist? Mechanism of primary chronic rhinitis development. Yeah. So, firstly, the reason causing stagnation in the nasal cavity mucosa. So it means the situation when mucociliary transport can't work properly, and the mucus uh, lives in nasal cavity for a prolonged period of time. So what factors can lead to such situation? Yeah, it's adenoid vegetations or adenoids, yeah, deviation of nasal septum, foreign bodies, synechia of nasal cavity, coan atresia, and neoplasm. And of course, general pathology is the wide spectrum of pathology. Almost any disease of any organ or system can lead to uh, rhinitis. Yeah, it's cardiovascular system pathology, it's liver cirrhosis, chronic kidney disease, diseases of lung, pathology of endocrinological system, and gout. Mm. Also, don't forget about action of external factors such as professional damage, yeah, dust, smoke, gases, pairs, dry or damp air, and meteorology factors, temperature fluctuation, change of atmospheric pressure. So uh, everybody uh, everybody has such situation as in winter. Yeah, we have good warming of our rooms. Yeah, and this warming may have negative influence on nasal mucosa. Yeah, because if the temperature of our environment, yeah, especially inside the room, is high, it uh, lead to dry air, and dry air lead to dry mucus. That's why during the period when our rooms are artificially warmed, yeah, it is better to use some saline irrigations, yes, to support the humidifying of nasal mucosa. It's quite important, yeah, because many problems with the nasal mucosa can be made on winter, yeah, due to dry air. Uh, Action of some medical drugs. Yeah, it's some hypertensive drugs, drugs with iod, contraceptives, and or abusing its overdosage of vasoconstrictive drops. Yeah. Also, it can be constitutional predisposition, change of an organism reactants. Yeah. Allergic rhinitis. No, about allergic rhinitis we will speak a little bit later. Classification of rhinitis. Yeah, it's big classification. Rhinitis can be, no, firstly, acute or chronic. After this, we divide infectious. Infectious rhinitis also can be acute or chronic allergic rhinitis. Two forms, intermittent and persistent. Non-allergic rhinitis with eosinophilia syndrome was active, drug-induced, hormone-induced rhinitis during pregnancy, food-induced, temperature-induced, psychogenic, idiopathic, hypertrophic, atrophic, azina, and other conditions followed by rhinitis. And also don't remember about such possible reason for rhinitis as drug abusing, when drugs is inhaled through the nose. So classification of chronic rhinitis. It can be chronic guttural rhinitis, chronic hypertrophic rhinitis, simple or hyperplastic, chronic atrophic rhinitis, simple or ozina, and vasomotor rhinitis, allergic form or neurovegetative form. So what is chronic guttural rhinitis? Chronic guttural rhinitis is the situation when we can see prolonged edema of nasal cavity mucosa with production of overproduction of mucus. Yeah, and of course the symptoms will be the next. It's the nasal obstruction. Yeah, because of mucosa accumulation and swelling of mucosa. Mucus secretion, sense of decreasing of smelling, lacrimation, and maybe neurological pains in the paranasal sinus region. During rhinoscopy, inferior nasal conchas are enlarged because of edema, as you can see in this picture. Hyperemia of mucosa and mucus in nasal passages. Treatment, yeah. As any treatment during any disease, yeah, the first therapeutical option is elimination of the rhinitis, elimination of the factors of rhinitis, yeah. And remember, please, that quite often the reason for chronic rhinitis is abusing of vasoconstrictive nasal drops. It's commonly it's situation when a patient, for example, has a nasal septum deviation and has frequent acute rhinitis. Yeah, it leads to prolonged using of nasal decongestants. Yeah, because you remember that if we see the instruction for vasoconstrictive nasal drops, you see that the maximum period of time when you can use it is 1 week, yeah, 7 days. But if a patient has some other pathology, another background, for example, nasal septum deviation, for him, the symptoms of rhinitis will be longer, yeah, and during this period of time, he or she may use these drops, and this overdosing of nasal drops after this lead to addiction to these drops, and the patient can't deal without drops with the problem of nasal breathing. So another form of chronic rhinitis is chronic hypertrophic rhinitis. What changes, morphological changes we can reveal? It's increasing of number of blood vessels in nasal conchas, in hyperplastic form, in all sides of mucosa, proliferative processes are observed. So it's cellular infiltration. The volume of fibra tissue increased, cysts formation may be found, and also increased the bone part of conchas. The clinic may be the same, yeah, it's expressed nasal breath difficulty, it's constant discharge from nose, nasal drip, decreasing of smelling, headache, reflex cough, sometimes it's maybe hearing decreasing, and the nasal shade of or nasal form of voice, yeah, so-called rhinolalia clause. During rhinoscopy, we can see the narrow nasal myotasis. Pulmonary mucosa is brightly red or cyanotic, and mucosal edema and hyperplasia bottom of inferior and middle nasal conchas. Here you can see the very hypertrophic ends of inferior nasal concha, and it is the changes of anterior ends of nasal concha. In this case, only in most cases only surgery can help the patient, yeah, because we need to remove the increased part of mucus, yeah, increased part of bone of nasal concha, yeah. So the methods are electrocatheterization, yeah, submucosal electrocatheterization, cryodestruction, and submucosal cryodestruction, and all other methods. Ultrasonic decomposition, laser can be used also. How it, as you see here. Very rare concatemia can be used, yeah, but if you choose such type of treatment, remember that very important to leave the anterior end of inferior concha, yeah, because inferior concas play very important role in formation of air flowing in nasal cavity, yes, and it's better to remove only if it is needed the posterior ends of concas. So what is simple chronic atrophic rhinitis? Its situation opposite to hypertrophic rhinitis. It's situation when uh, the one moment, I see a word. In the situation when the volume of nasal mucosa decrease in hypertrophic rhinitis is increased, this in this case it's decreased. What can be background for this process? It's external condition and professional harm, constitutional predisposition, hormonal infringements, uh, the thickness of this layer decrease of nasal mucosa. Neurostrophic problems, infringement of ferrum exchange, hypersiderosis, children after infection disease, some, yeah, and after operative interventions in the nasal cavity. So the picture will be opposite to hypertrophic form, yeah. So we can see the metaplasia of cylindric cilia epithelium, goblet cells disappeared, and you can see that the thickness of nasal mucosa decreased, yeah, due to reduction of mucous bands and blood vessels number. The patient can feel dryness in nasal cavity and pharynx, formation of crusts, periodically can be nasal bleeding, nasal breath difficulty, and also decreasing of smell sense. So during rhinoscopy we can see white myotosis, turbinates are reduced in volume, mucus pale, dry, covered with crusts, but also it may be hyperemic. And the more aggressive form of atrophic rhinitis is so-called fetid chronic atrophic rhinitis, AZINA. Yeah? There are some main theories of Osina development, but the main theory is infectious, and in most cases of Osina, such bacteria as Klebsiella osina can be found. Also, it can be some elementary reasons and deficiency of ferrum in blood serum. What changes of nasal mucosa we can see under microscopy? Yeah? It's complete metaplasia of cylindrical cilia epithelium to multistrate flare. Mucosa is almost deprived of mucus gland. Obliterating endothelitis phenomena in blood vessels and sharp atrophy on nasal turbinates or stem skeleton. Yeah, here you can see the picture of Osina. Yeah, so the patient can complain to dryness in nose, nasal breath difficulty, sharp, pure smell from the nose, crust formation, and resistant anosmia. Yeah, here you can see the crust that have very bad smell. The volume of a nasal cavity is decreased, yeah, and you can see very severe dystrophy up to atrophy of nasal conchus. So, treatment. If we are speaking about Osina, it's of course antibacterial therapy and use antibiotics that are sensitive for to which Klebsiella osina is sensitive. Also biostimulations, vitamins and drugs that contain the forms of iron. Also you may use local procedures, irritating procedures, yeah, removing crusts and mucosa humidifying, laser irritation of nasal cavity, vacuum therapy, and sometimes, not very often, surgical methods of treatment may be used, and these methods are used for narrowing of the nasal cavity volume. So, vasomotor rhinitis, this is the triad of corrective symptoms: complicated nasal breath, repeated sneezing, and clear watery discharges from nasal cavity. And the main form of vasomotor rhinitis, it is the allergic rhinitis. Yeah, allergen plays the leading part in the etiology and a seasonal allergic rhinitis. Classification we will speak in next slides. Yeah, there are two main forms. Yeah, it's the seasonal or in international classification intermittent and constant or persistent. As you understand, if the allergic rhinitis is seasonal or intermittent, so the symptoms can be revealed only during exacerbation of process, yeah. And if the allergic rhinitis is constant or persistent, the symptoms may, the severity of symptoms may vary, but commonly it's usually present. So what are the main symptoms? Yeah, it's nasal breathing difficulty, discharges from nose, sneezing, decreasing in smelling sense, eye symptom. Quite often allergic rhinitis are accompanied with a bronchial asthma or atopic dermatitis. It's a classification area 2019, but it's still actual. And here you can see that allergic rhinitis is divided on two main forms, yeah, intermittent and persistent. If we are speaking about intermittent symptoms, it means that the symptoms are less than 4 days per week or less than 4 weeks episodes during year. Persistent, it's more than 4 days per week and more than 4 weeks episodes during year. Commonly during seasonal allergic, no, I don't fully agree with this, that the symptoms are mild, because in a period of intensive symptoms, the symptoms decrease the level of life very much. And yes, here you can see the forms, yeah, of forms of severity of disease: mild, moderate, and severe. And all these three forms can be met as in patients with intermittent rhinitis, also in patients with persistent rhinitis. So during rhinoscopy, yeah, you can see edema of mucus, severe edema of mucus, porcelain painting of mucosa. Sometimes you can see hyperplastic changes of mucosa or even polyps. And also we can see in such patient allergic salute. It's the situation when patient commonly how to say, touch his nose with the hand because of itching. For allergic forms are such symptoms. So how to differentiate this allergic rhinitis from other forms of rhinitis? Frankly speaking, it's not very difficult, especially in case of seasonal rhinitis, because the clinic and anamnestic data is quite clear. What we can find in anamnesis? Yes, it's some allergic urination. Also, we may find eosinophilia in blood, eosinophilia in nasal secretion, positive skin test with allergens. It's a diagnostic manipulation. Such patients very clear say that we have symptoms only on, for example, May or in August, if we are speaking about intermittent rhinitis. And very often in such patients, someone in very close relatives also may have some allergic problems. Treatment, as usual, firstly, if it is possible, allergen elimination. If we are speaking about allergic rhinitis, its antihistamine drugs are still actual, especially in intermittent form. But the main drug that I used in the case of allergic rhinitis is nasal corticosteroids. Yeah. So it's the nasal sprays that contain steroid hormone. Yeah. For example, or mometazone or fluticasone. The strong side of these drugs is that these corticosteroids only applying on nasal mucosa and don't move into general blood. Yeah, so these drugs don't influence on whole body. Yeah, only local influence. Other forms of inflammatory rhinitis can be treated with the elimination of anatomic anomalies in nasal cavity, downturn of the raised nervous system reactants, and reflex therapy. But of course, except of this, and a few words about diagnostic of this disease. Yes, the gold standard of diagnosis of allergic rhinitis is skin tests with allergens. Yes, so-called prick test. It's the manipulation when solution with antigens are placed on the forehead, forearm of the patient, and through this liquid prick with special needle is done, and the skin begin to contact with the antigen, and if this reaction is big, so we can understand that this patient has allergy to some antigen. If we are speaking about seasonal or intermittent form, it's commonly pollen, yeah, pollen of different plants, depending on season. If we are speaking about persistent form, it's the antigens of home pets, yeah, such as cats, dogs. Yeah, it's the antigens of flora of pillows and dust, home dust. And also can be met other from different forms of rhinitis. It's a very big field for scientific work because there are, as you can see, there are a lot of forms of rhinitis. Yeah, NAR, NINAR, NANIPER, NEAS, NARMA, NARNE, NARESMA. Yeah. Non-allergic rhinitis, non-infection, non-allergic rhinitis, non-allergic, non-infections, perennial rhinitis, non-allergic rhinitis with eosinophilia syndrome, non-allergic rhinitis with mast cells, non-allergic rhinitis with neutrophils, non-allergic rhinitis with eosinophils and mast cells. Yeah, very a lot of uh, difficult diagnosis, and to establish one of these forms, firstly you must know that such forms exist, and then to use special methods for uh, uh, diagnosis. So for today, I have said everything that I wanted. So good luck, and don't forget that your next lecture will be, one second, your next lecture will be on the 8th of December. I'll bring here in chat. Don't forget that visiting all lecture will give you some additional points for your final mark.